Hello, my name is Miriam. Thank you for listening to this presentation from Edinburgh in Scotland. The presentation is about implementation of the 4AT delirium detection tool in clinical practice. Delirium is an important condition to screen for as it is associated with worse outcomes for patients. There are multiple delirium assessment tools, yet validation data for these tools have mostly been generated under study conditions. There are few studies providing information in full clinical populations on tool completion rates and proportions of scores positive for delirium. The 4AT stands for 4A's test. It is a widely used, validated clinical tool for delirium detection. It does not require special training and takes less than 2 minutes to complete. The 4AT is scored from 0 to 12. A score of 0 indicates delirium or cognitive impairment unlikely. A score of 1 to 3 indicates possible cognitive impairment. A score of 4 to 12 indicates possible delirium. We know that the 4AT is an effective screening tool from randomized trial evidence and meta-analysis. What we do not know is how successfully this tool can be implemented into clinical practice. In this work, we examined completion and detection rates of the 4AT in 2 university hospitals. We analysed electronic records on all consecutive patients aged over 50 admitted to acute medical wards between April 2016 and May 2019. We assessed completion rates by routine clinical staff, 4AT scores, and length of stay. Here you can see a screenshot of the 4AT embedded into our electronic health records. Of the 69,000 consecutive admissions aged over 50 years old, 74% had a completed 4AT. In the patients with completed 4AT, 64% had a score of 0, indicating unlikely delirium or cognitive impairment. 19% had a score of 1 to 3, indicating possible cognitive impairment, and 17% had a score of 4 to 12, indicating possible delirium. The median length of stay in days increased from 3.6 days in patients scoring 0 to 9.2 days in patients scoring 4 to 12. These data suggest that the implementation of the 4AT in the acute medical admissions process is feasible, with a 74% completion rate for older patients. Just to highlight, all patients aged over 50 were included in this work, which is quite young for older patients, so we feel 74% is a high completion rate. The overall rate of 4AT scores positive for delirium was 17%. This figure is broadly in line with existing study estimates of the prevalence of delirium in acute medical patients, suggesting that the 4AT is detecting delirium at an appropriate level. Further studies of the 4AT and other tools in large clinical populations will enhance our understanding of the implementability of delirium detection tools. If you'd like more information about the 4AT, please see the website at www.the4at.com. Thank you very much for listening, and I would like to thank all of my co-authors for their help with this work.